Hi, I'm Richard Petitt and I'm representing Southend Carers, a local charity that supports unpaid carers. How safe is the COVID-19 vaccine long term?
These vaccines are a wonderful result of collaboration by scientists all over the world. They have been independently put through their paces. They have gone through their tests in the laboratories, out in the field. Then their data has been looked at by independent verifiers in the United States, in the European Union, in the United Kingdom, and in other parts of the country. Just because these vaccines were created in less than a year does not mean corners were cut. They are as safe as any vaccine that has been released out in the field. We have identified some concerns, some very rare concerns with the AstraZeneca Oxford vaccine. And this is a good result of post vaccination surveillance, which has managed to pick up a unbelievably unusual, unexpected, very rare uh, link between blood clots and vaccine in a very, very, very few number of people.
Do people get clots generally, and how does this compare with the vaccinations?
In the normal population, people often get clots. So if you do a long haul flight on an aeroplane, for example, your risks of developing what we call blood clots due to deep vein thrombosis are considerably greater. Furthermore, for example, if you are a smoker, your risks of having blood clots are also considerably greater. Furthermore, if you are on the oral contraceptive pill, your risks of clots are also greater. And one more final thing, and very important, if you were to get COVID-19 disease by infection, your chances of having blood clots are also considerably greater. So, all those factors put together compared to the rare, the unusual, the unexpected, idiosyncratic reaction in some people following the vaccination is a low risk compared to the travel, the oral contraceptive pill, the smoking, or COVID 19 disease.
Some of our carers are managing their risk from COVID by managing their health, they're eating well, exercising, taking supplements, and just generally staying away from other people. Are they at a low risk of catching COVID?
It is always good to maintain good health for many multiple reasons. Having maintained good health, unfortunately, does not prevent you from getting infected. And with the virus in widespread community circulation, it is only a matter of time before somebody gets infected. Therefore, the best strategy is multifaceted. One, do all you can to remain healthy. Number two, do all you can not to get infected. And number three, avail yourself of the vaccines that protect you and have been shown to prevent you from getting severe disease. And by severe disease, I mean ending up on the ventilator. And remember, people who end up on the ventilator often die. Therefore, the strategy is remain healthy, do all you can to protect yourself with infection control measures, and also give yourself a layer of protection by getting the vaccine and giving that additional protection to yourself.
Doctor, what are the common side effects of the vaccine?
The main known side effects of the vaccine are localized tenderness at the site of the injection, a feeling of a very heavy arm. Furthermore, some people also report feeling feverish, tired, lethargic, and a mild headache. For all these known expected side effects, my advice is take 2 tablets of paracetamol 4 times a day to help you feel less um, tired, worn out, headachy, feverish. these signs and symptoms usually pass in a couple of days' time.
Thank you. And with regards to the unusual, rare side effects, what should we look out for?
In some people, under very rare, unusual circumstances, we have identified that some people, with the AstraZeneca Oxford vaccine, go on to develop severe headaches which are persistent over 4 days, reports of blurred vision, shortness of breath, aching, painful legs, abdominal pain. If you suffer from any one of those unusual, unexpected signs and symptoms, it is important that you call your doctor and mention that you have this very severe headache that is very unusual for you. You may have blurred vision, mention it, that you have sudden shortness of breath, that your leg is hurting, or you have got pain in your abdomen. Any one of those series of signs and symptoms, in very, very rare cases, it's still worth calling your GP and mentioning it to them as soon as possible.